first med check, so 261A, and it's for Mr. Gray, so it's the right patient, and we're giving Nitroderm. So here it is, nitroglycerin patch, the right dose, 0.3 milligrams. So I'm comparing the order to what I have. So this is 0.3 milligrams. It's the right route, it's a patch, and he gets it on his chest wall. It's the right patient, it's the right drug, the right dose, the right route. I'm giving it at the right time. He's not allergic to it. And the med has not expired, so that's one. Coumadin is at 5 p.m., multivitamins at 5 p.m. Furosemide is now. And so I have a little med cup. And so I have my furosemide, 20 milligrams for Mr. Gray. He's not allergic. It hasn't expired. I'm giving it at 9 a.m. So the right patient, drug, dose. He's getting it orally. It's the right time. And then the last thing is OPTC eye drops. For the left eye, he gets it at 9 a.m. Hasn't expired. And for Mr. Gray, no allergy to that. All right, so I have my meds. That was my first med check. I'm gonna lock up the med system. I'm gonna step away and I'm gonna do my third med check. And I'm gonna step away and probably I'm still in the med room. And honestly, if I have a cup full of pills, I just dump them all out and do the same thing again. So again, I'm making sure I've got Mr. Gray. He has no allergies. I have his Nitroderm patch. It's the right dose. It's a patch to his chest wall. Hasn't expired. I'm giving it at the right time. And then this is his Lasix again. 20 milligrams orally, 9 a.m. Not allergic, hasn't expired. Mr. Gray. Same with his eye drops. Hasn't expired. It's one drop to his left eye, 9 a.m. No allergies. Okay, so that was my third check. Second check. All right, so now I need to gather some supplies for Mr. Gray. He has nothing in his room. He has water. I see water in his room. We're gonna grab something, because I need something like, so when I take off the old patch, I wanna clean any residual medication on his chest from the old patch. So I need like a washcloth. Don't use an alcohol wipe, because again, you don't know, when you take the old patch off, you don't know how alcohol interacts with the medication that might be on their skin. So not a good idea to use an alcohol wipe to clean the skin. Plus alcohol's really drying. And then I also probably need like a tissue or some kind of cloth to wipe their eye. So I'm gonna bring some of those in. Gloves should be in the room. I have everything. He has water, I already checked. That's the other thing, like when you're gonna give past meds, make sure your patient has water. If they need their pills crushed, make sure there's a pill crusher in the room. Go get applesauce out of a little kitchen and a spoon. Bring that to the room. You don't want to get to the room and be like, oh, I need a spoon. Oh, I need applesauce. Oh, now I need water. It's just gonna waste a lot of your time. All right, so it'd be nice if I had a little table. Anyway, I'm outside the room, right? I'm gonna hand sanitize. So I'm gonna put all my stuff down. You have your computer table so you could put your stuff down. I need that little podium. All right, so I hand sanitize, go in the room, knock on the door. It's Mary, I'm back with your medications. I see you have some water. Use this water. I think I have everything. There should be gloves, I see gloves. So I have a pill, a patch, and your eye drops. So also, let me just use this just as a little visual. This would be attached.
I was looking for it.
This would be attached to your computer. It wouldn't just be. So the next time I'm going to use that little blue table, it would be better. So can you tell me your full name and your date of birth. And let's hope he says John Gray, 9/7/1958. So what he says matches his wristband, and it matches the MAR in front of me. John Gray, 9/7/1958. I probably won't have it on now. Mr. Gray, have any allergies that you know of? No? No allergies? Says no allergies. My little scanning gun. I gotta scan the patient, right? Ask him his name, date of birth, compare it to the wristband, compare it to the MAR. Beep, it'll beep or do something. It makes some kind of noise when it's like took it. It'll say, like in Meditech, it says patient verified. There's gonna be a way on the MAR that it will show you electronically that the patient's been verified. So beep, okay, patient verified. I think I'm gonna give you your pill first, Mr. Gray, your furosemide, your Lasix. So again, my third check, right? So I've got my Lasix, 20 milligrams. It's for Mr. Gray. He's not allergic to it. I'm giving it at the right time. He gets it orally, so it's the right drug, the right dose, it's the right dose, it's the right route, it's the right time, right patient. Scan it. Beep. Put it in your med cup. Give it to Mr. Gray. It's your Lasix, Mr. Gray. You want me to pop it in for you? Yeah? You get it, right? Make sure Mr. Gray swallows. You got it? You got it? Oh yeah, he swallowed it. We're good. I don't know you guys. I save these too. Like, I don't save them, but I don't throw everything right in the garbage. I don't know. I check like 15 times. Let's just leave the empty pill packet there. I always just save it until the very end. I'm gonna do your patch last. So I'm gonna do your eye drop next. So, again.
And Mary, just one other thing is, so let's say they had multiple pills and he refused a pill, or let's say he had to check his blood pressure and it wasn't good enough to give a pill, physically separate that one from the ones that you're scanning.
Right.
Because again, you never give a pill that you didn't scan. And so if he says, I don't want my Colace, or I don't want my Senecot, if you keep it right with the other pills that you're scanning, there's a lot more chance to make a mistake and give it to him. Or the same with the blood pressure pill. So physically separate anything you're not gonna give, so that you don't make a mistake.
Yeah, and a lot of times, like with blood pressure meds so anything where I have to check something, like I have to check their heart rate, I have to check their blood pressure, I keep them in a separate cup. So literally, I have like those meds in one cup and all my other meds in another. I do that all the time. Anything I have to split in half too, I do the same thing. I would have 2 cups. So if I had to split a pill in half, I put the pill that I have to split in half in a separate cup. When I was a new nurse, I don't do this so much anymore, but when I was a new nurse, I used to write on the bottom of the cup to remind me. Like, if someone needed their apical pulse taken, I would write AP, no kidding, on the bottom of the cup and put the pill in there so I remembered. And that stayed separate. I did that all the time.
Physically separate.
Or, I physically separated them because like Kim said, in case you don't give it because their apical pulse is too low, you don't want to accidentally scan it and give it. I used to do that all the time, right on the bottom of the cup. All right, so then we're gonna scan his eye drop, beep, and it's gonna come up on the screen and it's gonna ask you which eye you're giving it in, and it's gonna ask you how many drops. So he gets 1 drop to his left eye. I'm gonna put at least 1 glove on because maybe he has some like drainage around that left eye. So again, just warm water, not soap, but something with warm water, something I can run under the sink and just, get anything that's dry off of that left eye, right? Remember wiping in and out. I'm sorry, I'm getting rid of these gloves, right? Because I just touched his eye and I'm not touching anything else. All right, I'm gonna I think I can do this with 1 glove. Here, Mr. Gray, I'm gonna give you a tissue. You can dab there you go. That's for the eye drop. 1 drop. Like we say, do your 3 med checks. I feel like I do like 5 med checks. So I am going to, remember, I'm going to lower his lower lid. I always wear gloves with eyes. You have the potential to come in contact with body fluids, right? So I'm gonna wear gloves. you're gonna lower the lower lid, you're gonna expose the, what's it called? Conjunctival sac, and you're gonna place the prescribed number of drops in the conjunctival sac. So I'm gonna look, you can't do it with the mannequin, guys, sorry, but you get the idea. We're gonna lower the lower lid, expose the conjunctival sac. We're gonna drop 1 drop into the conjunctival sac. Don't touch anything with that tip. And then you're gonna let go, and either the patient can press the inner canthus to block the tear duct, or you could do it for them. I think like 15 to 20 seconds is fine. And then, right, you'll be done with that. And now I'm gonna do the patch. Let me put this on.
The other thing is the cap for the eye drop.
Oh, yeah,
See
did
how
you
she
see
took
how I
it
put-
off?
See how I left it like that? Leave it up like, that's true for any cap. Like,
Yeah, any cap,
if you put it down like this, that's considered contamination,
because there's bacteria on them.
right? So the table is dirty. Now I'm gonna take the cap. I just
Yeah.
picked up bacteria from the table onto there. Alright, so that, and see how I get everything out of my way? Like him, like get stuff out of your way when you're done with it. I'm gonna try to do this one glove to the patch. So let me see. You do have an old patch. I'm gonna take that old patch off. I'm gonna put the new patch on your left side. So here's my patch. This one is chest wall, 0.3 milligrams. I have to replace it at 9 AM. He's not allergic to it, Mr. Gray. I'm gonna open this, gonna scan it. Beep. I have to make the sound effect free. I'm gonna put this right here. I kind of press the center of this patch. I'll peel it off. I don't want to touch it this one. I'm just kind of folding it in half. I'm going to dispose of this in the proper receptacle. Do not put it in the garbage. Don't put it in the garbage. If it's a narcotic patch, 2 nurses have to witness the removal and the waste. Just wherever your facility disposes of patches. Here in the lab, you can throw it in the garbage because it's nothing on it. It's just a sticker. So we're gonna do that. We're gonna take a cloth, some kind of wet washcloth with some warm water and soap, and just clean that old area, right? We're done with that. If this were oily or dirty or there was tape or something, I would clean this side too, right? I wanna put the patch on a clean site. So again, this is my Nitroderm. I'm just gonna peel, I'm gonna hold this like this, and peel this part off with my glove. Really don't wanna touch nitro. I'm gonna put it on the right side this time. Gonna just hold it on there to make sure that it's gonna stick onto his skin. And then I would take my tape, right, a little piece of paper tape, and then I would just write just your initials, the date, the time, and just put it anywhere. Put it here, just somewhere next to the patch. Just don't put it over the patch. And even on the MAR, you have to document. We usually document removal, where you took it off from, and where you put the new one on. And look everywhere. Like if you get to the patient and you expect to see a patch on their left chest wall and it's not there, just look everywhere, you guys. Like, have them sit up, look at their back, just accidentally, I don't know, they peeled it off, put it somewhere else. Then just look everywhere for patches. Just look, yeah, you gotta take the patch off, right? Because you don't wanna build up a medication in the patient's system. I was once a supervisor, and a patient came into the ER, an elderly patient with low blood pressure. And when the patient got there, they looked at the patient and they had patches, nitroglycerin patches all over. I don't know, like the family didn't understand, but you're supposed to take the old patch off. So no wonder why the poor person had low blood pressure. They had nitroglycerin patches all over them. So just look for patches.
When you're practicing, make sure you're checking that you're putting the drop in the correct eye. That's another
Yeah.
reason people fail skills testing, is they do everything right except it says left eye.
You know
and
what they
put it in
do?
the right eye.
They look at the.
Right, when you're
They
looking at
think
the
like,
patient.
they'll say
versus-
like, okay, so it's the patient's right eye, so this right eye, and they go with their right, and then they go over here, and like, well, that's the patient's left.
Yeah,
It is your right, but, yeah.
so just double check the eye.
All right, Mr. Gray, we're all done here. You good? He's good. Got a call bell? You got your call bell? It's right here. I'm gonna say that's his call bell. That's it, you guys.